Hi, my name is Jordan. I'm a nursing student at Vanguard University, and today I'm going to be talking to you about bipolar disorder and the advantages of treatment for the mental illness. So you may be asking, what is bipolar disorder? It is a mental illness characterized by rapid mood changes of manic and depressive episodes. Approximately 2.6 of the U.S. population are diagnosed with bipolar disorder, and nearly 83% of cases are classified as severe. Bipolar disorder is often misdiagnosed due to symptoms being similarly related to schizophrenia, borderline personality disorder, and other mental illnesses. Delay in treatment can cause the illness to manifest into suicidal tendencies and ideations, although it can be treated with pharmacologic and non-pharmacologic interventions. As with many mental illnesses, bipolar disorder doesn't have just one cause, rather it has a multitude of reasons, such as childhood trauma secondary to abuse, adverse life events, primarily negative situations, and family functioning. The causes mentioned affect bipolar disorder because childhood trauma is known to be a primary indicator in at least 50% of confirmed diagnoses. Each negative life event that occurs increases the onset of bipolar disorder by 10%, and family impairment through what's known as expressed emotion. This is when the individual is surrounded by a family environment filled with hostility, criticism, and emotional over-involvement. So symptoms involving manic episodes of bipolar disorder. Manic episodes result in feelings of overexcitement, having a lot of energy, increased activity levels, having trouble sleeping, talking fast about a lot of different things, becoming agitated and or irritable, feeling like their thoughts are going very fast. For depressive symptoms of bipolar disorder, some symptoms can feel very sad, down, empty, or feeling hopeless, feeling very little energy, decreased activity levels, trouble sleeping, either too little or too much, feeling like they can't enjoy anything, trouble concentrating, feeling tired, and thoughts of death and suicide. So to receive an accurate diagnosis of bipolar disorder, it comes down to two diagnostic test screenings. First one being ICD-10, which is International Statistical Classification of Diseases and Related Health Problems, and the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. Prior assessment will include information about episodes, including the frequency, symptoms of episodes, duration, suicidal behaviors, and agitation. So there's often a prevalence of misdiagnosis due to uncertainty in bipolar disorder during the beginning phases of the mental illness. Approximately 46% of the patients suffered from alcohol abuse, 41% had a comorbid drug abuse and dependence. The other mental illnesses that bipolar disorder can be misdiagnosed are under panic disorder, obsessive compulsive disorder, social phobia, eating disorders, schizophrenia, and borderline personality disorder. So now we're going to talk about the treatment. For pharmacologic interventions, clinicians usually administer mood stabilizers, antipsychotic medications, and antidepressant medications. Although mood stabilizers are typically better because they're more commonly used in symptom management for mania and depression, and they also help with preventing suicide relapse. For non-pharmacologic interventions, these are usually done alone or in a group setting and consist of cognitive behavior therapy, interpersonal and social rhythm therapy, family-focused intervention, and psychoeducation. These are most helpful because they reduce episodic relapses and provide the patient better adherence to treatment and improve overall functioning. Psychoeducation is known to be the best course of action because it provides education about the mental illness, allows the patient to come to terms with the mental illness, which gives them the ability to recognize symptoms before they start. Also, the group therapy setting allows for shared experiences with other patients in a supportive environment. This can also provide them insight about other treatment methods, such as information about medication involving contraindications and potential side effects. If patients will fail to receive treatment, this can impact the quality of life, cause complications with relationships, will cause manic and depressive episodes to be more frequent, and present a high risk for suicide. A study has estimated around 25 to 60% of all cases attempt suicide, and around 4 to 9% of the attempts are completed. So why would a patient not want to seek treatment? Failure to recognize the mental illness requires special attention, as some individuals may not see. They could also be in denial about needing to take the medication, in terms that they would have a fear in the potential side effects and negative impacts in life presented by the medications. They also believe that they might have a dependence to the medication for the rest of their life. and with the beliefs that the medication will not be very effective. They also might have lack of knowledge, suffer from cognitive impairment, or also lack of support from dysfunctional family environment. That is all for today. I hope you guys enjoyed my PowerPoint slide. Thank you very much.